Hi, Dr. Andrea McSwain here with one of our patients, and I wanted to ask her some questions. How long have you been hurting?
Since I was about 11, so 15 years.
Okay. And what kind of pain were you having?
Just really stiff. My ankle wouldn't really rotate at all. Went up into my body, so I literally dragged my right foot around with everything else, like every other muscle in my body. So,
Had you seen some specialists?
yeah, I seen two different specialists. I seen a foot specialist, and then I seen an ankle specialist before I came here.
And what did they tell you?
That I had to pretty much get it broken and relined, that they had to cut bone out of my foot, the back of my foot, and cut a hole in to make an arch, like in like the side of my foot. That's what they pretty much told me.
Okay. So it sounds like you think you needed surgery as your only option.
Yeah, I was preparing to go like on leave at work.
Okay. So then you started working with me and my staff. And how long in receiving treatment did you begin to notice results?
Like maybe my second visit, a week or two into it, I started noticing more movement that my body I wasn't used to. I mean, it didn't always feel good, but you could definitely feel things moving that I didn't know moved. I was so used to being locked into one spot that I noticed that almost right away.
Okay. And describe a day before you started working with me and my staff. What was that like?
I mean, I normally work 8 or 9 hours a day. By the time I was done with a shift, I was literally holding on to walls, car doors, anything. I literally had no life left in my foot at the end of the night. I mean, I've had my 5-year-old help me off the couch because I couldn't move at the end of a normal, something that people without this problem wouldn't think twice about just after work.
And now describe a day.
I mean, it's still tender, but I last almost twice as long without grabbing for things to walk. I don't drag my foot anymore, really, unless it's like I know I've overdone myself for the day. I feel a lot better, just not so stiff, just achy. I don't feel that as much anymore. It's a lot more open, and I mean, even the facial stuff that you've done, like my breathing is different, and just the way I move in general is different. I've had people that see me every day like mention it several times to me, just about the way that I walk. So a lot better so far, for sure.
What did you think about when you started working with me to take supplements and to change your diet?
I didn't think the supplements would really do much. I was set on surgery. I didn't think vitamins would do anything for my foot, to be honest. I really didn't.
What about your diet?
I mean, I've always known I didn't eat very well, so I knew that it would affect it. I just didn't realize that I would feel it as much as I do now. Like, I mean, I'm not perfect on my diet by any means right now, but when I do eat something I know I shouldn't, I feel it more than before. I didn't really notice my body telling me no before, and now, like, it's like instantly upset. Like, I'm starting to realize things that I didn't notice before about my diet since I've taken things out and slowed down on eating certain things.
Good.
Yeah. Definitely, I pay for it more quickly than I did beforehand, for sure. It's a good thing, though. I need to realize when my body's not happy about something. So
How about your mindset?
More positive. I mean, it's hard to be positive when you're dragging your foot around and holding onto walls when you're 26. You know, it's a lot more positive outlook on it now that I know I don't have to get cut open. I don't have to feel like that all the time.
Okay.
Yeah, it's a much brighter, I'm not where my ending goal is, but it's a lot brighter path for me to actually, like before I didn't even want to talk about it. I didn't want anybody to look at my foot. I didn't want anything said about it. I didn't want to see anyone about it because my first initial thought was just cut it open. I can't work. I can't stand. I can't move. I didn't even want to have that conversation. Now that I know that that's not the only way for me to go, it's a lot more promising for me.
Thank you.
Yeah.
Thank you for sharing your story because it makes a big difference.
Yeah. I appreciate everything. I do.
Good.